This is another short video on some clinical tips that we use in our office to make our lives easier. This one today is about how we use OpalDam Green for difficult isolation and to fabricate a matrix for buildups. And this kind of goes along with the modern theme of saving some of these questionable teeth, which has had a tremendous resurgence in the last couple of years as we have found problems with implant dentistry that come up after many years of having an implant placed. So some of these teeth really would not have been even attempted to have root canal treatment and restorative treatment in 2008, and now there is definitely a big demand for it. So we like the OpalDam Green because it was originally designed as a barrier for in-office bleaching to protect the gingiva. It has qualities to it where it's a soft cure resin. And it's important to have the assistant kind of follow you around with the curing light because there's not a lot of depth of penetration because OpalDam Green is opaque. We like that though because the green color contrasts well with the teeth and the gingiva, and we use it to isolate difficult teeth and as a matrix for complicated buildups. So it comes in this blue tube and you syringe it in place and cure it. We use it, like I said, in some rather heroic situations. And this presented to our office one day, and it was an emergency situation like a lot of the patients we see. Her chief complaint was the middle of her tooth was bleeding, and you can see this is fractured through here, right in the middle of her crown. It goes down on the lingual, and then when we remove that segment, we can see why it was bleeding. There was an oblique fracture that had extended down subgingivally on the palatal side. So when we take a look at this, this is kind of a mess, and it was something where OpalDam Green kind of saved the day for me. So I was able to put a little OpalDam Green first over that gingiva and protect it, and then after I isolated the tooth, I put more OpalDam Green over that, and now I have a pretty well controlled situation where I can do root canal treatment fairly routinely. So that was actually the easiest part of this, doing the root canal, and then I had prepared into the OpalDam Green to make a little bit of a notch here to then flow my buildup material. So once we did that, we were able to place a post and then place a buildup and then flick the OpalDam Green off. This has more height to it that doesn't really show up on this picture. But now this can be used as a finish line, and it doesn't necessarily have to go all the way down to the extent of the fracture because this tooth has root canal treatment and this isn't going to become sensitive. And that's the way she left, to go back to her general dentist office and have a crown placed on that tooth that day because this was a very aesthetic conscious person. So other places where we'll use it is if there's just a lot of decay. Now this is a tooth that sometimes I think is expendable, an upper second molar. However, this person had been away from dentistry for a long time and really had an emotional attachment to this tooth, which seems like it always comes down to an emotional decision on some of these questionable teeth. So to isolate this was going to be rather difficult to isolate, do the buildup, remove the decay, and not have our irrigants leaking out the distal. So before we got started, I went ahead and removed all of the decay here on the gingival floor. Actually left some decayed enamel back here to hold on to my OpalDam Green, and then I flowed that into that area. So now I have a clean margin down here to eventually place my buildup, and I have isolation and a barrier and matrix on the distal. So then after root canal treatment was completed, we went ahead and placed our buildup into this area, and now this is some decay and some OpalDam Green and then solid dentin and buildup. And this went back to the general dentist with instructions to continue prepping until they didn't see any more green on the distal, and then they were pretty much good to go. And this made our lives a lot easier as far as placing a predictable buildup and not having irrigation solutions leaking out the distal. We also like it to make a matrix if we're trying to do some of these buildups where there isn't much of the tooth left. And these bicuspid teeth are often this way. We have a fair amount of buccal tooth to work with, not a whole lot of palatal tooth to work with. So in this case, after root canal treatment is done, I flowed the OpalDam Green into this area. Then we prep into the OpalDam Green to kind of create our own shape of what the buildup would eventually look like internally. And then that allows us to place a post, cure it, place our buildup, and then we can kind of re-prep into that area to establish a finish line, and then we can just kind of flick the OpalDam Green out of the way. And then we have our restored tooth with buildup, ready to go back to the general dentist for some sort of restoration. I wanted to leave as much of this buccal enamel as possible. So I hope this video gives you some tips on something that can be used in some of these more dire situations. And again, the theme of a lot of the things we're going to be talking about on these videos is how to extend the life of a tooth and how we manage some of these more heroic situations. And I do believe there is a lot of value to this. And even if we're just kicking something down the road, you know, a decade or so, that's good too. And this is really something that has become a bigger part of our practice in the last 5 years. I hope you enjoyed this.